Radiculopathy is a term that describes the irritation of a nerve. This irritation can come from mechanical compression of the nerve, or it can come from chemical irritation of the nerve. Nerves of the spinal cord exit through little tunnels in the cervical spine called foramen. As the nerve exits through the foramen, it can be pinched by a bulging disc, it can be pinched by a very tight foramen, or a bone spur in that foramen. All of these are examples of mechanical compression, somewhat like a clothespin pinching your nerve. Additionally, there can be absolutely no mechanical compression whatsoever, but yet there can still be radiculopathy, or the feeling of pain or electrical shock shooting down the arm. This is explained by something called chemical radiculopathy. Each disc has two parts, a center called the nucleus pulposus, and an outside covering, leather covering, called the annulus fibrosus. The nucleus pulposus has chemicals which are naturally occurring that are irritative called cytokines. And when you get a tear in the leather covering, or annulus fibrosus, these chemicals can irritate a nerve in the same way that mechanical compression can irritate a nerve. Radiculopathy is diagnosed by physical examination, by imaging, and even by something called EMG, where we test whether the nerve is healthy or not. We can treat radiculopathy through activity modification, medications, and when these things fail, we can do minimally invasive procedures such as epidural steroid injections. Ultimately, if all else fails, or the damage or irritation to the nerve is severe, in a very small percentage of cases, surgical intervention is required. So if you're experiencing symptoms of radiculopathy, that is electrical shock that can start from your neck and go all the way down to your fingertips, come in for an evaluation. We may be able to treat you with something as simple as a medication, physical therapy, activity modification, or in worst cases, an epidural steroid injection. Of course, if you have such severe injury to your nerve that it's affecting the strength in your arm, you might even require, in rare cases, surgical intervention.